Good morning, everyone, and thank you for joining us today. Every year, as part of Vaccination Week of the Americas, more than 40 countries and territories in the Americas come together to recognize the significance of immunizing and vaccinating their populations. This week is Vaccination Week, with the theme, Engage Now to Protect Your Future. During Vaccine Week, we try hard to help those who may not access to health services. Our aim during Vaccination Week is to encourage more people to get vaccinated so we can reduce the vaccine from spreading within our community. We are encouraging parents to vaccinate their children and their infants according to the Bermuda Childhood Immunization Schedule. This week, we're going to focus on encouraging everyone to get the MMR and HPV vaccines, making sure people know how important they are. Everyone between the ages of 9 and 45 can receive protection against HPV-related cancers. The HPV vaccine can shield against genital warts and several types of cancers, including cervical, penile, anal, throat, head, and neck cancers. The MMR vaccine is vital for protecting against measles, mumps, and rubella. Measles, being very highly contagious, can cause high fever, respiratory problems, and severe complications like pneumonia, meningitis, blindness, and seizures. The recent resurgence of measles in many parts of the world, including the Americas and Europe, has increased the high risk of measles importation and transmission to our islands. Measles outbreaks have continued to occur globally, with periodic spikes in cases in various regions. Factors contributing to these outbreaks include vaccine hesitancy, suboptimal vaccination coverage, and gaps in immunity. The Center for Disease Control and Prevention, or the CDC, reports that as of March 21st, 2024, a total of 64 measles cases were reported by 17 states. And the UK has had over 346 cases since October 2023, with 124 positive cases since January of 2024. The World Health Organization reports that last year, more than 58,000 people in 41 of its 53 member states in the region, straddling Europe and Central Asia, were infected with measles, resulting in thousands of hospitalizations and 10 measles-related deaths. Measles is a highly contagious virus that can live in the nose and throat mucus of the infected person. It can spread by coughing and sneezing from an infected person. The droplets can last up to 2 hours in the airspace. The CDC says that the virus is so contagious that up to 90% of people close to the person who is not immune will also become infected. Measles is extremely serious, especially in children under the age of 5 years of age. Measles can cause health problems, including pneumonia, blindness, and inflammation of the brain. Before traveling, ensure that you and your children's routine vaccinations are up to date, including persons attending the ICC Men's T20 World Cup cricket events that are taking place in most of the United States, as well as West Indies in June of 2024. You can receive the MMR vaccine at your doctor's office or at the adult immunization and travel health clinics here at the Department of Health's Hamilton Clinic at 67 Victoria Street. To strengthen the uptake and increase confidence in vaccines in Bermuda, the extended program of immunizations under the Department of Health will have catch-up clinics at the Victoria Street Clinic beginning on Wednesday, May 1st, 2024, from noon until 4:00 p.m. Before I close, I would like to invite the public to download the Healthy People BDA app. It is available for download to your smartphone or tablet from the Apple iStore or Android App Store or Google Play. You can find the latest vaccine and child health information, and it is a space to collect reliable health information. And I encourage you to download the app and familiarize yourself with this resourceful and useful tool for all members of the community to use. Thank you very much.
Good morning. Thank you, Minister. As the EPI Acting Manager for Bermuda, I would like to say that I want to encourage everyone who is not up to date with their vaccines that they could come in on the 1st of May. We'll be having an open clinic from 12 noon until 4 p.m. And they can have their MMR, HPV vaccines, or any vaccines that they would like to catch up on. And for the Week of the Americas, we'll be celebrating by having a workshop from 12 until 4 p.m. on Wednesday for all healthcare workers in Bermuda. And we also have, we also have the, I'm sorry.
Facebook form.
We have slogans that we'll be advertising on the buses as well. So that will be going up shortly. And if you have any questions, we'll try and answer them. Or I'll ask the director if he has something to say. Thank you.
Good morning, everybody. I don't have much else to say. It's just as if you are susceptible to these vaccine-preventable diseases, it's quite easy to either check with your GP, check with your pediatrician, or check with us. And please get up to date, not just to protect you from disease, but also the inconvenience. So measles is one you could heard from the minister's statement, is one that we're particularly concerned about in the public health community. It is something that our colleagues in North America and in Europe are also concerned about this summer with increased travel. And if you're susceptible to measles, obviously there's the illness risk, but also if you're not fully vaccinated, there's a particularly long time that you would be having to take precautionary measures. But if you are vaccinated, even if you become a close contact, you can pretty well go about your normal life just monitoring your health. So it's really worth getting up to date with your jabs. So thank you for my colleagues who are doing everything this week, and to the health system who's also going to be helping people access their HPV and their MMR. Thank you.
I will yield to the technical people behind me. However, I will say that I think that one of the unfortunate issues that relates to vaccine hesitancy is false information. And regrettably, we have a lot of false information on the internet, and everybody's a doctor or a researcher on the internet, and they're relying on information that's not reliable, which is why we're encouraging persons to upload the app that we spoke about, because you can get reliable, correct information with respect to any of the vaccinations.
Okay, so we reiterate that vaccine hesitancy most of the time is due to lack of knowledge. So people tend not to understand what the vaccines can do and how effective it is to them, their children, and to themselves, and how it protects the society. So we try to educate them as healthcare professionals, and that is what we're trying to do for Vaccines Week of America.
Okay, thank you. That concludes today's press conference.
Thank you.
Thank you, guys. Oh, now the sun's
Yeah.
No, that's cool. Thanks, you guys.